Hello everybody, I am Dr. Saleha Kausar Abdul Salim, practicing gynecologist at Parbhani, Maharashtra. I am practicing as a gynecologist and infertility specialist at Parbhani since 30 years. So I have got a lot of cases of infertility, treated about more than 6,000 cases and got success with the bless of God. So my experiences are there. The natural conception rate in my patient is more. The natural conception, why it is more, I will let you know. How the treatment in my cases, I go from the basic cause of the infertility. Lot of cases I have seen that the infection is the most important cause in the infertility. Many of us go only for ovulation monitoring, but it is the last measure. So first we go for infective part in the pelvic infection. So in my routine practice, by doing the treatment, I have gone through the pelvic infection cases. When I got one machine, colposcopy, there is a great role of colposcopy in infertility. When I have seen the cases of cervical erosion and treated the cervical erosion, many cases of pelvic infection got conception after treating the cases of cervical erosion. But we were wondered, and some of them are worried how the cervical erosion is causing the infertility. When we are treating the patients of cervical erosion, the cervical erosion is the mainstay of pelvic infection. When there is raw area over the cervix, it acts as the source of infection of the pelvic infection. And the ascending infection in the uterus from the erosion, it goes in the uterine cavity, and from uterine cavity it goes into the fallopian tube, and it gets the fallopian tube blocked. So the patients they directly go for IVF, but there is no need of IVF directly. First we should treat the cervical erosion by scraping out the infection. Then with the cold cautery or with the hot cautery, we can cure the patient. Then with the support of the IV antibiotic, then with the oral antibiotic. After treatment of the cautery, we have to repeat the colposcopy after 1.5 or 2 months. When big erosions, we need time of 6 to 8 months for complete cure of the erosion. If the erosion is small, we can get the treatment in 3 to 4 months period. So we have to follow the case, and with the support of the cautery treatment plus oral antibiotic, then afterwards the cure of the erosion, we have to follow the ovulation follicular study. Then after follicular study, even if after ovulation there is no conception, then we can opt for laparoscopy. Other problem of adhesions or in the pelvic infection, or the endometriosis infection is there, or tuberculosis infection is there, that we have to find out. With the basic infection treatment, we can get the success in lot of cases. And in poor patients also, when they cannot opt for laparoscopy directly, in that amount we can get treated lot of these cases, and lot of this antibiotic course also we can do in the poor patients. So at periphery, this our setup at Parbhani district is this small district, and here we get the patient which are not affording. So we have to go from this basic test, and we are getting the success by the grace of God in this small test and this simple treatment. This tool is also a tool to prevent the cervical cancer in future for the patients. I have seen the patient, and when I have taken the biopsy from the erosion, lot of cases I have seen the histopathology report as a cervical metaplasia. So I also wondered, and I am very happy that I have seen these cases, and after treatment, after 3 to 4 months, after I got the report as a chronic cervicitis. So I am very happy that I am also preventing the cervical cancer of the ladies. So I am very happy that this colposcopy is working as a tool for in cases of infertility also, and also preventing the cervical cancer. Thank you.